Yep.
Hi, my name is Jessica Bisbee, and this is my neighbor, Miss Sherry, and she is a psychiatrist for the Folsom Prison. And for our presentation, Psychology and the Law, I was going to ask her a few questions. So, where did you go to school, and what all training did you have to go through?
Undergraduate college, then then medical school, a 4-year residency in psychiatry, and then I did an additional year in a forensic fellowship.
Very nice. And where was this at?
UC Davis Medical Center was the psychiatry training.
Very nice. All right. So why did you want to become a prison psychiatrist?
I always was real interested in psychiatry, and it seems like a lot of mentally ill end up incarcerated. During training, I worked in the jails, and it just seems more and more the patients end up in the prison, the very interesting cases, the very ill people. I like working with substance abuse also, and obviously that's going to end up in the prisons and jails.
All right, describe an average day of work.
Now I do a part-time administrative work and part-time patient care. So in the morning I go and kind of see what's going on in the unit for the day and arrange if anyone's out who will see what. We have a morning meeting, kind of getting everything set with everybody. Then I have patients that come in. They're not right on the dot because they have to come when custody can find them and that kind of thing. So I see outpatients now, so they come into my office and see me. And there are various meetings. Today I had a suicide prevention video conference, and today I taught a class in some new policy we're doing with the prison system. In the past I've worked inpatient. They have inpatients in the prison and the jails too.
Very nice. Right. What was your most interesting case?
That's a really hard question because they're different. And I really like different ones for different reasons. I've always liked very, very sick people, very psychotic. And I find it really interesting what you can do with medications and see changes so abruptly compared to somebody you're doing long-term therapy with. When I was next door at the other prison, I had a lot of real psychotic patients who would, I had one guy who would rip out his belly, literally rip out his parts of his intestines, and we had to restrain him for, I think, 6 to 8 weeks because we couldn't stop him from doing that, even with medication, so we had to let it heal. Others I've enjoyed, ones that I can really talk to. There was one that I managed a couple of times when he was inpatient suicidal, and he was probably one of the most psychopathic people in that he didn't seem to feel emotions. Yet he killed his girlfriend and taped it, and knew it was wrong, didn't really feel much, thought about dying, didn't really have much feeling about it, and he was quite intelligent. He was a very bright person and could talk about it and articulate and discuss his feelings and theology and that kind of a thing. And that was interesting. And drugs are the other thing. You see a lot of, a lot of cases where the drugs are involved. A lot of interesting court cases. I mentioned that one to you earlier. There was a case I dealt with in the prison where actually he was a very likable guy, bright again, and he was bipolar. He was a rap musician and apparently had been taking PCP daily for some, I don't know how many years, and really became psychotic. He ended up killing a friend and ate parts of her body, and when they found him, they found the parts in his stomach, and he had no recollection of it. And when he talks about it now, he's just shocked and very remorseful, and he's just a normal person. Yeah, it's very interesting to see what the drugs can do. It's very sad.
Definitely. What is the best part and the worst part of your job?
I think the worst part is getting up every day and going, just because I don't like to have to get up early every day and go.
Yeah.
It's more fun to do cases in the jail or something like that where you can come and go. The best part, I really like patient care, I have to say. But it's really interesting. There are interesting cases. I've done ongoing therapy with normal people who are not incarcerated, and I like that too, but I find that histories of these people more interesting. You don't really get deep and try to dig up past trauma and work through it because there's too much. You try to go with where they are now and move on and see what can help them function. But they're people that really need help. I really do. There's also really good benefits right now with the state compared to working private practice.
Yeah.
If you work private practice, you have to, deal with saving your own money and paying insurance and all of that. And you're with colleagues, which is also nice. In psychiatry, it gets kind of hard if you're working on your own. You don't have somebody to discuss a case with.
Mm-hmm. Do you see more cases with mental illness or more deviance?
Recently, I've been in 2 very different prisons. And the one I'm in now, the people are not really real mentally ill. I have a lot of depression and bipolar, and people that could function if they were doing okay. The one I worked at a couple of years ago had extremely mentally ill, people from state hospitals who they couldn't manage due to violence. But what we have an awful lot of is mixed. People who are deviant and mentally ill. And sometimes when you get rid of the mental illness, you medicate them, the deviance is stronger because they can think clearer.
Yeah.
Or you can work with it. It goes both ways. But usually it's not one or the other. It's usually a mixture.
All right, well, thank you very, very much.
Sure.
It was a pleasure doing the interview.